Assalamu alaikum. How are you? Hello to the world. I hope you all be enjoying good health. This video is in a continuation of the previous video. The next contraception method, which is also called the birth control method in the common language, is contraceptive implants. What is this? It is actually one or two small rods or capsules placed under the skin of a woman's upper arm. Little to do once implants are in place. It's very effective for 3 to 5 years depending on which implant is being implanted. It can be used at any age and whether or not a woman has had children. It's very effective for those girls which are sexually active without marriage, and they don't want to conceive. They can use for that. They're very safe for them. A woman can have a trained provider take out the implants at any time, then she can become pregnant with no delay. Unexpected light bleeding or spotting may occur or a monthly bleeding may stop. It's not harmful. And one positive thing, a very positive, which I personally like about this, that it is safe during breastfeeding. Another is the injectable contraceptives. It's also effective and safe. One injection every 3 months. 3 months means that for 13 weeks roundabout with DMPA, and every 2 months with NETEN. These are the small names, the shortcuts that we use in a medical terminology. Come back as much as 4 weeks late, or DMPI, or 2 weeks later for NETEN, and still get the next injection. These are all the medicine injections that you will get. May be able to get injections outside the clinic in the community. Spotting and irregular bleeding often occur in the first several months. Often monthly bleeding stops, gradual weight gain, and mild headaches, but it's not harmful. It's very private, like others cannot tell that a woman is using it. It can be used at any age and whether or not a woman has had children. When injection stops, a woman can become pregnant again. After 3 months injection, it may take a few more months. It's safe during breastfeeding, beginning 6 weeks after childbirth. And the monthly injectables may be available with monthly injectables such as cyclophem. Monthly bleeding usually becomes lighter and shorter or less frequent. Spotting and unexpected bleeding can occur as well. The next is, we call it the lactational amenorrhea method. We call it LAM on the short term. A family planning method based on fully or nearly fully breastfeeding for up to 6 months after childbirth. A breastfeeding woman uses LAM. When? Let me tell you. Her baby gets little or no food or drink except breast milk, and she breastfeeds often, both day and night. And the monthly bleeding is not returned yet, and her baby is less than 6 months old. She can definitely go for the option of LAM. Before she can no longer use LAM, a woman should plan for another method as well. Another quick method is condoms. It helps prevent pregnancy and some sexually transmitted infections as well. The most common are HIV and AIDS, which use correctly when it is used correctly every time. For the protection from the STIs, HIV, some couples use condom along with the other family planning method, which is also a good option. Easy to use with a little practice. Effective if used correctly every time, often not used every time. However, some people object that condoms interrupt sex, reduce the sensation, or embarrass them. Talking with a partner can help in that regard. The other is the combined oral contraceptives, which is by pills. It is effective and reversible without delay. Take one pill every day and start new packs on time for the greatest effectiveness. Remember one thing, if you take it in time, you will be perfect with the go. But if you do not take it in time every day and you skip this, it won't help you I don't think so it will help you. Unexpected bleeding or spotting may occur, especially at first, but it's not harmful. Monthly bleeding becomes lighter and more regular after a few months. Some women have mild headaches, weight change, upset stomach, especially at first, and these often go away with time. You have to give yourself some time. Safe for nearly every woman, serious complications are very rare. It can be used at any age and whether or not a woman has had children. It helps prevent menstrual cramps, heavy bleeding, anemia, and other conditions. One thing, the combined oral contraceptive are also used for the menorrhagia problem. What do I mean by this? When a woman is having the menstrual problems, she can go for these contraception pills, and when she take it on a regular basis, the required there is the treatment plan written that on the tablet pellet, and when you follow that, you definitely will have your menses normal then. The other method is the diaphragm with a spermicide. Women place his diaphragm deep in the vagina each time before intercourse and can do this ahead of time. It's effective if used correctly every time. Remember one thing, all these are effective only when you use them correctly in a correct time. Usually women must have an internal examination to get the diaphragm of the correct size, but very great disadvantage here is that the bladder infection is more common. Then we use for progestin only oral contraceptive, but this is a very good choice for only breastfeeding mothers who want pills. It's very effective during breastfeeding and reversible without delay. Take one pill every day for the greatest effectiveness. If not breastfeeding, spotting and unexpected light bleeding are common, but again, this is not harmful. The other methods are the permanent contraception, like when a female has undergone a female sterilization or a male undergo vasectomy. These are the two processes. Let me give a brief idea about that. Female sterilization is meant to be permanent, and for a women who are sure that they will not want more children, think carefully before deciding. You have to be very, very careful about that. You don't decide at once. This is a very serious topic. You have to think about it for a month at least with counseling of your partner to either go for this or not. It's very effective, but again, it's still not 100% effective. Involves a physical exam and safe, simple surgery. The woman usually stays awake and pain is blocked. Pain and swelling can last a few days after procedure. Serious complications are rare. There are no long-term side effects, no effect on the sexual ability or feelings, and it can be done right after childbirth as well as at other times. But again, I will say you go only for this choice when you have completed your family and with a 1 month thinking about this. Vasectomy is also permanent, and for men who are sure that they will not want more children, think carefully before deciding. Again, I will say this to the men out there: use another method for the first 3 months until the vasectomy starts to work. Very effective after 3 months, but not 100% effective. Safe, simple, convenient surgery as well, and done in a minute, and the pain is blocked by the giving them the local anesthesia. Pain, swelling or bruising can last a few days. A few men can have lasting pain. It has no effect on the intercourse ability or feelings. There are another fertility awareness methods that a woman learns to tell the fertile time of her monthly cycle, right? She should tell about her ovulation day. During the fertile time, a couple avoids the intercourse or they use another method such as condoms. It can be effective if used correctly, usually only somewhat effective, however. Can be effective if used correctly, usually only somewhat effective, however. It requires a partner's cooperation and no physical side effects. Certain methods may be hard to use during fever or vaginal infection, after childbirth, or while the breastfeeding. But this was a little review about the family planning choices. The one which you like, you may go for that. There are different types, and the one who suits you well, which is suitable for you or your partner, definitely go for that. That's all for today. I was very busy in the previous days, and inshallah, in the next couple of days I'm also busy as well. As long as I find the time, I'll give another video, and that's all for today. Have a good day. Allah Hafiz.